Good afternoon and welcome back to the Philadelphia College of Osteopathic Medicine, School of Pharmacy, Georgia Campus, ASHP-SSHP Clinical Skills Competition Case Number 3, ASHP 2014 National Case for Meningitis. As always, please leave your comments and concerns in the comments below so that we can improve these sessions. For those new and joining us today, my name is Michael Cooley at the PCOM Georgia ASHP-SSHP. I'm the student chapter president for the academic year of 2017-2018. I'm currently a P3 working with faculty and staff to provide an example of a pharmacist care plan for another ID case where we dealt with neurosyphilis previously. If you have any questions, go ahead and please refer back to the clinical skills competition formatting review in our YouTube videos to see the trends of cases over the past years. The ever so important disclosure: my view doesn't reflect in any way the views of the faculty, staff, the school, and of ASHP. The school has no financial ties or disclosure. This information is not sponsored by ASHP. This information is never to be used as medical advice or substitute for a medical professional. If you are having a life-threatening emergency, please call 911 or go to your nearest emergency room. Remember, with any soap note, methods and your consistency are key. So, if you have any questions, please refer to the Clinical Skills Competition Formatting Review YouTube video on our channel. These are the formal references provided to you during the national competition per the student handbook, so please utilize all these resources for your team's benefit. Before we dive any deeper into the Pharmacist Care Plan, what are your acronyms? My acronyms are All Smash, FM for my subjective, Def Tacos for my social history, VAPE for my objective, and Mr. T for my plan. Any objective that you find or create, make sure that it's easy for you and your team to remember. Looking at my subjective, referring back to my acronym, ALL is allergies, SMASH, the first S is surgery, M, past medical history, the next S is social, which is Def Tacos, which will be explained in the next slide, H is history of present illness, F is for family history, and M is for medications. And looking through the important factors for this case, for his allergies, we can see that he has a sulfa allergy or a rash, which is fairly common, but is definitely something to consider when we're treating his diagnosis. For the past medical history, we have GERD, heart failure, rhinitis, and always keep in mind if the past medical history is either a risk factor or part of the primary disease state. For the history of present illness, we have neck pain, headache, nausea and vomiting, and a seizure that was resolved, but it still required intervention nonetheless. This is very important to notice because it was secondary to the meningitis and it required treatment, which is more than likely going to be in my plan, stating that this seizure will require another intervention. For my treatments, I want you to look through the home meds and see, are there any duplications of therapy. The first thing that I see is the ranitidine and pantoprazole. Given together in most cases, it's not very commonly seen, and it's something to keep in mind when treating. Given in my social history, or my Def Tacos, I can see that there is nothing in particular that really stands out. So in this case, I would note for my intents and purposes, there are no risk factors present, and she is still functional in her day-to-day activities. Alright, let's look at the objective. Let's vape. By looking at his vitals, physical exam, and his labs. For his vitals, we can see that he has a heart rate of 112 or tachycardic. We also see that he has a temperature of 102, which must be addressed. Physical exam, we see the nuchal rigidity, Babinski signs, or the plantar reflex, which is also indicative of a disease at the spinal cord of the CNS. For his lab, you'll see abnormalities in his glucose, white blood cell count, and with a lumbar puncture, which also confirms the diagnosis at the printed reference in the back of the case, or for meningitis. Remember, as we see in the past case with neurosyphilis, any of the pertinent labs that are pending should be addressed in your plan, stating that you need to look at them before discharge. In this case, the gram stain and the cultures need to be reevaluated for sensitivity and should be monitored. Alright, for our assessment, we came up with a prioritized list, and again, always utilizing any tools in your reviews to help your cases. So, our number one problem, or our most urgent problem, is the meningitis, most likely to be bacterial. We're still waiting for confirmation on the labs. His number two problems are things that must be addressed within the visit, are the seizure activity, analgesia for the intubation, hyperglycemia due to the stress related to the intubation, fluids or electrolytes and nutrition also related to the intubation as this patient is low NPO, VTE prophylaxis, and stress ulcer prophylaxis, again due to the mechanical intubation. Number three problems are things that can be addressed at follow-up, include the heart failure, again, mainly because that she is already stabilized, allergies, her GERD, her insomnia, and her vaccines. Lastly, let's look at the plan. My acronym is Mr. T, and that's because Mr. T was part of the A team, so he will give you a plan. And that would make your monitoring and your therapeutic endpoints, your recommendations of therapy, and your therapeutic goals. So let's take a look at some concepts. Remembering that all your risk factors and your comorbidities of the primary problem should be addressed. And in this case, especially looking at the intubation because it resulted from a seizure secondary to the meningitis. And this really focuses on the student's ability to make the inference that this becomes a secondary problem. Intubation is an invasive procedure, and it does require anesthesia. And if you've never looked at intubation before, it is something that is mentioned in your references. So, it would also make her a recipient for the enteral nutrition and the electrolytes because she's NPO. For her heart failure, I want you to look at her home meds. Because of the class of heart failure that she's currently in, or the ABCDs of heart failure, whenever you treat heart failure, you have to look at the ABCDs of treatment. That would include your aspirin, your ACE inhibitors, your beta blockers, your CCBs, and your diuretics. Not all of them go into a certain class, but that is just an easier way to remember what treatments are available. So, with that, I conclude today's session. I hope it helped you today. Please leave your comments and concerns down below. Thank you, and have a good day.